Well, that report provides a background to the discussion which we're about to enter now, and we've been joined by Dr. Obinna, who is the National Vice Chairman of the Joint Health Sector Workers Union. You're welcome to Sunrise Daily this morning.
Thank you very much for having me.
I'm sure a lot of Nigerians were concerned when they saw that meeting you had with the Minister of Labour. I don't know if the Ministry of Health was represented there, but very conspicuously, we saw both ministers of Minister of Labour and the Minister of State for Labour. It means that, at least that's what one can read from it, that they have taken your threat for strike pretty seriously, and it would seem that negotiations are already underway. We understand that you met from that night, from night of the 7th into the following morning. Were you able to make any headway? Let me put it that way.
Well, thank you very much for having me once again. The essence of strike, or the essence of giving ultimatum, is to call the attention of the government to a prevailing strike situation. And that we have done. And before now, we've had several ultimatums served the government. And at the wee hours of the expiration of the ultimatum, you now see the government inviting us. This one was even very fast. They did well this time around to call us for dialogue. But the problem with all of this unending dialogue is that after you have reached a compromise, after you have distilled the discussion into MOA, that is a Memorandum of Action or Agreement, you still find out that the willpower to implement those agreements are not there. For instance, on the 30th of September 2017, we had a 16-point demand that agreements were reached on. And some of those issues had timeline. Some of them were supposed to have been activated, executed and implemented within 5 weeks, some 2 weeks. That was the catalog of how it should go. And but to our surprise, after those timeline, the government had not done anything about these issues. And in 2018, we waited for about 1 year. Nothing had been done. 2018, we had to begin another strike in the month of April. And from April to May, nothing tangible was done. Instead, we were visited by the no work, no pay rule, and we were taken to court. And the judge at the National Industrial Court of Nigeria ordered us to go to the this alternative dispute resolution arm of the court. We were supposed to work there for about 5-6 weeks. But at the end of the day, we spent 6 months. And eventually, on the 29th of March 2019, there was this consent judgment that was rolled out by the ADR. From then till now, none of those consent judgment agreements had been implemented. Now we are in 2020, the COVID issue came up, so everybody remained calm. And around that 2020, around September 13th, we also served the government another ultimatum, which expired, and we had to go for a 7-day warning strike. The government did not even bother to invite us for any dialogue, for any talk, for any update on what they are doing to arrest the situation. It was on the 21st of July, 2021, this year, that the Federal Ministry of Health, after our communique was sent to them, and we also reiterated that the way we are being treated is not fair. That was when the Director of Hospital Services invited us to a meeting. And it was the same old story that be patient, we are working, and we cannot see any visible reaction. I'm a scientist. There are sometimes reactions may be going on. you may not see any visible result or reaction then. It's not that actions are not going on, but at the end of the day, it will be very visible that something has taken place. But this one, we have not seen anything tangible. The rate of entropy is high. There is now entropy, and the entropy is bringing forth an exothermic reaction, which is very hot.
These are scientific terms.
Yes, that's
entropy.
Entropy. That's the rate of disorderliness. That is what's happening in the health sector. The entropy is there. That is change in heat. And the exothermic reaction is what is happening now. The heat is palpable. And there are lots of crises because the government should be held responsible for reneging on their CBA. Nobody, they didn't enter this CBA or this MOU under duress. They were the one who put forth the timeline, the various timelines. And we have been telling Nigerians that we are not strike mongers. One of the problems we have in the health sector is underfunding. Just imagine, the highest budgetary allocation for health in Nigeria so far is about 6.12% in 2012. In 2019, it was about 4.14%. Same for last year. This year, even with the advent of COVID, is just about 4.45%, as against the AU benchmark of 15%. Go to South Africa, just behind us here. Their budgetary provision is about 12.5%. This 4.4% that is rolled out of the entire budgetary provision of about 30 trillion just is a reflection of 547 billion. And when you now divide it by 200 million, it translates to about 247 naira per month for an average Nigerian to seek health.
Now, you've heard that you've had the Minister of Labour counter that to say that, look, every time people talk about budgetary allocations to health, they're always looking strictly at health. They don't look at other areas that are closely related to health. So, for instance, he thinks that when water is provided under the Ministry of Water Resources, that's potable water and a few other things, when, health is captured under education, these are all ancillary budgetary allocations to the health sector as well, and we need to take cognizance of that.
Then you should ask yourself, what is the end result? Maternal mortality in Nigeria, where the Nigerian record is about 20% of the global maternal mortality in the world. So nobody should fool anybody. We have indicators that should portray, even if there is holistic budgetary arrangement and wherever. But what we are saying is that Nigerians are impoverished. And, for example, when you go to the pharmacy shop, you just want, malaria is the most common illness here. How much do they sell a packet of anti-malaria drug? Your 247 naira cannot afford a good malaria drug. And that is the reason why we say, even in the health sector, we have infrastructural decay, obsolete equipment. And at the end of the day, even the National Health Insurance Scheme that the government has rolled out is not working, because when you go to the pharmacy drug department, you always have this OS syndrome, that is out of stock syndrome. Some of the basic drugs are not there. Consumables are not there. Then what are we saying? That's why the labor unions in the health sector will continue to cry that the Nigerian government should be sensitive to the funding of the health sector, so that an average Nigerian will have access to health, accessibility, affordability, and availability of health. It's a social service that the government owes Nigerians.
Tell us some of the agreements which you have, which were reneged upon, which you reached at the ARD, Alternative Dispute Resolution Mechanism System, and which the chairman of your union, stated very clearly that not one of the 15, he said even the 5 points not one of them has been implemented. Can you shed some light on
well, like we've been saying, the first among the lists is the adjustment of COHES salary. Because we are the caregiver. If the caregiver is not cared for, how do you expect him or her to give effective healthcare service to the teeming masses? So in 2014, we pointed out that the COHES and COMES salary spanned from 209 agreement, and it was stated copiously there that whenever one of the salary structures is adjusted, same should be done for the other. In our CBA of 2014, it was also found there. By the time we presented this to the minister, he had none of this information before now. We showed him the document. And at the
Which one of the ministers?
The Minister of Labour, really, because he was the chief conciliator. And he had this, and well, anyway, we also presented that, look, the matter that you thought is still in court over this adjustment of COHES has been taken out of court because there was one NGO, Kingdom Treasure or whatever, that took JOHESU to court in 2018 during the episode of the strike. But finally, the National Industrial Court has ruled that functus officio has been entered. That is, the judge has washed his hand and has dismissed that matter, that we should go back to our parent ministry, go back and start renegotiation, right? But before then, already we were told that the high power committee had worked on the matter, and we were told that we were supposed to 22.6 billion was earmarked for the payment of that adjusted COHES. And before you know it, it dragged and nothing had been done about it. Then, two, we had been saying that the payment of our April and May salary that was illegally withheld in 2018 should be released. Now we also had noticed during the episode of this COVID-19 pandemic, we were the front healthcare workers who combated or still combating the COVID-19. There was a special COVID hazard allowance that was released. 50% of our basic salary was to be paid, but erroneously or intentionally, like we will say, some of our members were only paid 10%. We said the government should go and balance the remaining 40%. Up to now, it has not been done. And then we also noticed that most of the ADR consent judgment and other judgments that had been given in favor of our union had not been implemented. More importantly, the skipping, promotion arrears, and all other salaries that are supposed to be paid to our members have not been done. We just had at the last meeting that the fifth one, the retirement review of retirement age from 60 to 65 for workers, and for consultants in the field, 70 will just go to National Council of Establishments. You see, so none of these things, no categorical or concrete agreement or, implementation of any.
A lot of them, and one cannot say that you don't deserve your wages, but a lot of them seem to border on the welfare of your workers.
Yeah, like I told you, if the welfare of the care provider is not taken care of, how will you expect an efficient service delivery? Then two, I also mentioned here that we have been crying about infrastructural decay before now. It was the episode of COVID-19 pandemic that exposed the whole cry, because some of our political office holders could not jet out of the country again because of the lockdown. So they were able to see and understand all the noise we were making before now. So our cries have been justified by the present scenario playing out. You may ask, before now, how many molecular laboratories do we have in Nigeria? We had only 3. It was only 1 that was functioning then. But now, because of the COVID-19, we are having about 40 now, which is a good one. Then you ask yourself,
are we capturing this under those are some of the extraneous spending that have come out outside of the budget for health?
Well, again, you also know that during this pandemic period, we had external funding from outside to support us, palliatives and all that. So you cannot categorically point that it's from the 4.45% budgetary allocation for health.
No, that's the point I'm trying to make, that oftentimes when we talk about how much has been spent in the health sector, we only look stricter sensu at how much has been allocated to the budget for health. We forget that sometimes we are also supported by donor agencies, and we don't seem to capture that under our budget for health. Isn't that correct?
Well, you must have something on paper. How are you sure that you will receive support? You are supposed to plan for your country, not hinging on maybe support that will come outside. You don't put that, when you are doing budgetary provision, you strictly go by what you put down. If others come from outside, you don't now add it to your budgetary provision. That would be a plus if it does come. So, so
I'm looking again at some of the things that you demanded. I mean, the 5 points which you are asking for: payment of reviewed hazard allowance is also something that the doctors have asked for. The increase of retirement age from 60 to 65 for consultant health professionals. You want a review of how government is implementing COVID-19 special inducement and hazard allowance. They're very, very related, aren't they?
Yeah, they are related.
But they're not the same thing.
They are not the same thing, because that inducement hazard allowance was given to us during the episode or the upsurge of the COVID-19 pandemic. But this one we are referring to now is the one that will be constant. You know, we are being paid 5,000 naira as hazard allowance before now, before the government in their magnanimity quoted, decided to now increase it from 5,000 naira to a new rate, which is still under negotiation. Okay, so that's why we said there should be an upward review, and it should be implemented on time.
Talk to us about this one. Payment of salaries that is being owed members of staff of Federal Medical Center, Owerri, Jos Teaching Hospital and Lagos Teaching Hospital. Because we heard there the minister talking about how no member of staff is owed salaries. Maybe he was saying it in reference to the doctors, that the people who are owed salaries are the illegals. Do you want to talk to us about it?
It's not the same. You know, when, for example, the FMC Owerri issue was a topical issue then, the Nigerian government had encouraged every one of us to be a whistleblower, especially when you see any corruptive tendency in your system. Yes, the FMC Owerri people, workers there, the health workers there, we are spotted some corruption in the system, and the whistle was blown that there is this so many shady things happening. The minister sent some committee members. I was a member of that committee. We went to FMC Owerri because the members of staff withdrew services as a result of the management there trying to oppress them for speaking out. So some of them were denied their promotion, their salaries were withheld. That when we went into the matter, we discovered that they were right. An investigative panel was set up. Some of the equipment, buildings that were supposed to rise before that time, the contract has been paid and everything. The contractor has received its money, but no building standing there. It was when we got there that they started clearing the bush and started putting stones and whatever there. So we now said these people, salaries should be paid. They made a good, the useful information to the government. But why should you now deny them of their salaries because they started strike there? It's unjustifiable. So pay them their salaries. That's why we put FMC Owerri there. The Jute also had similar issue because they went on legal strike, pointing to the decay in the system. Their salaries were withheld. So we should now start to reverse the narrative. When government fails in her own responsibilities in meeting the needs of the workers, what should be their penalty? Why should they use the no work, no pay as a tool to cage and to cow the workers. It's also there in that Labor Dispute Act, T8, Section 43. That's where the no work, no pay is. But Section 41 talks about strike. Essential service providers can go on strike in as much as they've given 15 days ultimatum to their management or to their employer. So this is what is happening. So that money should be given back to the people because they did the right thing by calling the attention of the government.
This is not a case of people who were hired illegally.
No, it is not.
Are you in solidarity with NARD over their demands?
Well, an injury to one is an injury to all. There are some areas of common interests. Okay? We don't have permanent enemies or permanent friends in unionism. It is a game of common interests. If we have areas of common interest, why not? We shall solidarize with them. Why we expect them also to solidarize with us? This beauty contest in the health sector rivalry shouldn't be, because each person has his or our own line of duty. I mean, so if we are to work like team players, we are supposed to protect the interests of others in that team.
Let's quickly flip this to Lagos now, to my colleague Coyote.
Oh, thank you, Markwe. I mean, that question from Markwe is quite interesting because looking at the communique that you released prior to the meeting you had with the government, you referenced physicians, doctors a lot in that communique, spoke about even getting them to be bonded, as it were, when government pays for their residency training. You talked about there being some level playing field. So I imagine that when you say to some extent you agree in these other areas which you put in that communique, you clearly do not agree with the resident doctors. So that aside, I'd like to ask you, how much of a threat, or is there still a threat of a strike as it is today, right after that meeting you had with the government? Should we be worried that you'll still go on strike? Is it in how many days now? 13, 12 days?
Yeah, well, the ultimatum is counting. It's about 10 days more for it to expire. We are really serious about this matter because this time around, the demand for the strike action is coming from the members. They feel frustrated over the years for the government to not have met simple demands that the government entered into with the unions. So it's very disheartening. And that's why the issue of brain drain is common to everyone. Many of our professional colleagues are leaving the country because they are well trained, but they do not have the enabling environment to discharge their duties. No, the equipment we have now, they are very obsolete. It was during the era of President Olusegun Obasanjo that we had the VAMED equipment in about 12 to 14 hospitals in Nigeria. Many of those equipment now are obsolete. How many of these magnetic resonance imaging machines do we have now? How many of these accelerator machines or linear accelerator machines do we have? How many of these cancer treatment machines do we have in Nigeria? So we keep counting all of these. So when you are well trained and you do not have the facilities to work, we only train our personnel for other countries to harness, to take them away. Okay, and we are short-staffed. We are not, the healthcare professionals are not adequate in the country. So it calls for concern, and that's why the managerial skill in the health sector should be looked into. There should be a total overhaul of the administrative prowess. Let us put the right people there, administrators who are trained to manage resources and humans. Then those of us who are healthcare professionals, all of us should go back to our clinical area of interest. Leave the administrative area for administrators, head administrators, or other CEOs to take charge of.
I mean,
You
Dr.
understand?
Obina,
So
I believe these
the
are parts of
threat is real,
the conversations you've been having with government. I want to believe that. But I'm clearly asking, I mean, right after the meeting you had with Labour and other government representatives, I want to know if anything has changed. So, by the way, we did invite the Ministry of Labour also to get a sense of the thinking of government regarding that, but clearly they didn't show up. But we do hope that in the coming days we'll get them. But I would like you to tell Nigerians, after that meeting, that intervention, or whatever it might be called, has anything changed regarding the strike?
Sorry, I didn't get your question.
The question is, right after that meeting you had with federal government representatives, where Labour, we saw the budget office as well as others, has anything changed regarding your strike? You said that you were going to get back to your members with the understandings that were reached. Did anything come out of that such that Nigerians can say, well, JOHESU is no more going on strike, or JOHESU will still go on strike?
Well, as it stands now, nothing concrete or tangible had been agreed upon. That's why we are going to have another meeting on the 14th of this month. That is next week, Tuesday. Probably when the cards are laid on the table, we'll be able to see which one the government will be serious about in implementing. Then we'll resort back to our members to now, because at that day it will be about 4 days to the end of to the expiration of the 15 days ultimatum. So it's a serious matter.
Right. Did you sign any memorandum
This is
of...
not the right time for strike, really,
Right.
because of the pandemic. Yes.
Okay, did you sign any memorandum of understanding, any memorandum of agreement? Did you put pen to paper in any way at the end of that meeting or even during that meeting?
No, what will you sign? We have, there was no agreement on any of the issue yet. So how will you now sign? So I read in some publications that there was a truce. What's the meaning of truce? There were resolutions. We never agreed. The only thing that happened during that meeting is that we had an ambient environment. Everybody was calm to listen to one another, and labor dialogues have changed from banging the table to scientific presentations with facts and figures. That was what we did that day, and we were getting to understand ourselves that this strike is germane, it is legal, and the issues under reference are real, and the government is seeing it in that light, that there is need for government to do the needful at this period. If not, the ultimatum is still counting, and if it expires, then we'll be left with nothing than to go back to the trenches. And whatever the members resolve to do, we are going to provide leadership, because it is their call and their strike.
So when the Minister of Labour was quoted as saying the issue was resolved to the satisfaction of all of us, the government is not delaying the hazard allowance as some people want the public to believe, essentially saying that, well, there's been some sort of resolution. From your own side, clearly you don't think there's been a resolution.
Like I told you, the only resolution we had that day was a peaceful, ambient atmosphere to discuss the matters unfiltered.
So, I mean, resolution, the issues have been resolved means only one thing. The issues have been resolved, but clearly resolution for you means something entirely different from resolution for the government. And I think that's a major challenge for us to grapple with. But when you say that the strike is still on, as it were, help Nigerians understand who will be participating in that strike. So you have nurses. Just what will happen to the health sector if JOHESU succeeds in going on this strike?
Yeah, well, the strike is not on yet. We are just showing our intention to go on strike if the government do not meet our demands within the stipulated time. The expiration date will be midnight of 17th September 2021. Now, JOHESU is made up of 5 unions in the health sector: the National Association of Nigerian Nurses, the Medical and Health Workers Union of Nigeria, the Nigerian Union of Allied Health Professionals, the Non-Academic Staff Union, and the Senior Staff Association of Universities and Tertiary Health Institutions and Research Institutes, SATURI. All of us make up about 95% of the workforce in the health sector. So if the medical practitioners, especially the NAD, are on strike now, and the other 95% joins them, that is the JOHESU families joins the strike, I mean, my answer is as real as what you give. That means there will be total shutdown of the health system in the country. And I mean, it's the poor masses that will now bear the brunt because of the already impoverished nature and economic stress on them. Like I painted it, 247 naira per month is the budgetary provision for them. It's not a good omen. So we just want to plead to Nigerians to understand with us that our demands are also indirectly going to affect them positively if met. So they should bear with us. And well-meaning Nigerians, the Governor Forum, the SGF, and other government functionaries should prevail in this matter and see a way of resolving it before it gets out of hand. We want to plead.
I wonder how easy it would be really to get people that have clear medical emergencies to bear with you and the government through this all. I understand you have to say this, but I'm just trying to receive that as someone who needs to see, a doctor, a physician, or at least to be attended to by a nurse. I wonder how that will be received. And I'd like to go back to something, Mark, where I touched on earlier, and it talks about the working together of the health sector in general, the professionals in the health sector. You just said 95% of the 100% in the health sector is made up of JOHESU workers. Clearly, you are referencing a whole, essentially saying that you're meant to work together as a team, as a whole. And I see in that communique, you said that, well, you need some level playing field. In fact, you went on to say that physicians still enjoy the best working conditions. And even the physicians, I mean, they're on strike right now because they think they're not enjoying the best working conditions. So how can that be remedied, really?
We want the government to start taking every healthcare professional serious. And that's what we call job evaluation. Each person and each profession, we all have our line of duties. And no one is superior to the other. Government should not show overture and show favoritism to a particular group in the health system or health team to the advantage of the other group. Why we mentioned that in our communique was that we see a lot of disunity in our midst, discrimination as a result of the government's attitude. Like we have said in the past, that other healthcare professionals, we need residency training. Let it be instilled in the workings of the government policy. We use our own money to train ourselves in our postgraduate studies in order to bring effective healthcare services to the masses. We have been saying it times with that number. International best practices also put up residency programs for other healthcare professionals. In Canada, in UK, in Australia, you have that for pharmacists, for physiotherapists, radiographers, optometrists, and others in the health system. But here in Nigeria, we seem to neglect other healthcare professionals, and continue to promote the other medical practitioners alone. That's why we mentioned it in our communique, to draw the attention of the government to the fact that as team players, all of us should be given equal playing ground so that we can increase and improve our skills, and so that it will be brought down to the poor masses. It is a multidisciplinary approach that we look at. The patient is at the center. Every one of us revolve around them, and we should give the best to our patients, to the masses, to Nigerians. So postgraduate trainings should not just be meant for, the sponsorship of postgraduate training, either partly or fully, should not be enjoyed by the medical practitioners alone. That was why we pointed that aspect out, that look, we still see that they enjoy more favor than other healthcare professionals in the system. So that's one of the things we want government to look at. Let there be a holistic approach. No favorite child. All of us should be seen and be looked at the point of need. Whatever we bring to the government, have some international best practices underneath. We do not cry for what we do not require. So government should take us serious in that direction.
But, brain drain continues to be a source of concern to not just, I'm sure government must be concerned. I want to imagine that they are concerned. But a lot of Nigerians are truly concerned about what is happening, with regards to brain drain, especially when you look at the recruitment. That it's not like as if our doctors are or even our health workers are going to go and look for these jobs. The jobs are coming to look for them. Sure. Have you had any conversation amongst your members as to, what can be done to stem the tide of brain drain in Nigeria today, especially in the medical sector?
Yeah, it's everyday dialogue and discussion. I've told you one of the points. When you do not have an enabling environment to discharge your duty, you have been well trained, but you don't have the equipment to practice. Every now and then, there are frustrations setting in. Your welfare is not taken care of, and you have the skill, you have the competence. It's easy for one to now jet out.
I want to ask you, what has been the motivation of people like you who've stayed back?
Well, one of the major motivating factor, one is we have looked at it that if all of us jet out now, those of us who are activists, who need to cry out and call the attention of government to some of these things, if some of us also leave, who is going to bail the cat? For now, we are still here given the opportunity to say it the way it is. But if the opportunity comes, why not?
You mean you will leave as well?
Andrew will check out. That is it. Because every blessed day that you go into the work environment, you are received with frustration. Even your remuneration, when you compare with what you are paid, with what you get outside, you see it as peanut. But that notwithstanding, the joy of contributing to the well-being of your fellow man, it's the motivating factor that you are impacting. You are adding value to the life of someone who is about to die or who is ill. That's an encouraging factor. Most of the time, it's not even the remuneration you get. So fulfillment comes from having equipment to work, and you see that this patient is recuperating. You see that this patient is getting well. That's a motivating factor. But if you want to scale it down, you have families. You can see the rate of unemployment. You who is working, you have about 10 dependents. How much you take home? It's not just for your immediate family. You have to give some to your extended family members, your friends, and before you know it, you also get frustrated and you start to know some hypertension, thinking of how you're going to survive as well. So, especially now that we even have security situations revolving around us, the medical professionals are even targets because they believe in the society that they are well paid, and before you know, they may be target of kidnap. And when that happens, who will pay you? What will you? There are so many healthcare professionals that have been kidnapped in the past, okay? And they have to pay heavily for their ransom. Okay, so with all this stress, both in the general environment and the hospital environment, I mean, that frustration is setting in, and many people want to jet out if they have the opportunity. But government can stem the tide. If some of these things we have requested now is looked into and done immediately, well, people will be encouraged. The joy will come back. People will be happy going to their places of work, and they want to put in their best.
Well, let us hope, indeed, because hope is the only thing we can hang on to, that the pace with which they have used to answer the ultimatum which you've given, and the fact that conversations have started, will eventually yield good fruit. We have to thank you for coming on Sunrise Daily this morning. Dr. Ogbonna Obinna is the National Vice Chairman of the Joint Health Sector Workers Union. Thank you once again for coming on Sunrise Daily.
Thank you for that prophetic utterance. I will go by that, and we believe that the government will do the needful. Thank you very much.
We'll take a break at this point. We'll be back shortly, and we'll have politics on the table. Please stay with us.